Hello, ladies, and welcome to today's episode of Autoimmune Rehab Podcast, where, as always, you could access show notes and additional goodies at autoimmunerehab.com. Today, I am super excited to have with me Dr. Rosa Alexandria, and she's going to be sharing with us some really great things, including one of the more common questions that a lot of people ask is, how come my hormones are so messed up, and how come my autoimmunity is making it so that I can't lose any weight? So if you are wondering about some of the goody stuff about how you can finally start shedding off those pounds and start really getting to that side of your autoimmunity fix, stay tuned because we will have some really good information for you. Okay, so welcome to the show, Dr. Rosette. Why don't you start off by telling us a little bit about who you are and your background, what got you into the field, that kind of thing.
Sure. So I'm Dr. Rosa, and I am from Cleveland, Ohio. So the Northeast Ohio, we're right up on the lake there. And I've lived here for my entire life. I have three children, 18, 6, and 13. It's funny how I did that in that order.
Yeah.
I don't know why I did that. So I have my three children, and I have a private practice, so I do telehealth, telemedicine, and I actually just recently started my private practice, so it's just me solo. That's one of the questions I get all the time is, well, who are you with? And I'm like, myself. It's me. Um, and I had actually spent the last 10 years working at the bedside, doing critical care, cardiac dialysis, diabetes. That was all like the last 10 years of really intense bedside work that I did. And I finally decided to transition into doing something on my own that was more focused on holistic wellness and more focused on really treating the root cause. So my practice takes a very functional perspective to care. So getting to the root cause, looking at reversal, looking at, getting people off of medication or reducing the number of medications that they're on and really teaching them how to optimize their health for where they're at and what their goals are. Because everybody's got different goals, everybody's got different things going on. And it's like, well, what are you looking specifically to do? And I think that personalized aspect is what is really missing from modern medicine, from traditional healthcare right now. And it's just about empowering women, especially to take back kind of control over their own bodies, which I know sometimes it feels like we don't have any control because after we reach certain ages, like things just start happening to us. But it's an inevitable fact of life that we're going to go through different changes. But there's always things that we can do to really optimize our health and to feel how we want to feel and not just have to feel terrible all the time or be dependent on medications. There's so many other things that we can do with our lives. And me personally, I had a lot of skin issues growing up, a lot of autoimmune things. I have Bell's palsy, actually, which is a really has impacted a lot by my immune levels and my stress. And that was something that was newer to me that I found out within the last couple of years, and some thyroid things and a lot of skin and inflammation, a lot of those kinds of things. So we'll get into all of that, but I know firsthand because I did a lot of work on myself before I started wanting to share what I do with other women. And I focus a lot on like biohacking and doing some alternative complementary things. So we'll get into that as well. But yeah, just taking a different personalized approach to wellness and to healthcare overall is what I do.
I love that. And I think that's just a must. And you're right, that is very sorely lacking in our traditional healthcare system. And a lot of the women that I talk to that are not in healthcare, but that have, an autoimmune journey, there's quite a few episodes where I've emailed or interviewed rather women who have this autoimmune condition and they share about their story and about how they started getting into remission, or in some cases they got into full remission. A lot of them talk a lot about how in the beginning, and I know this was my story too, we really struggled to even get a diagnosis in the first place because the traditional healthcare system is just not equipped to handle it. And autoimmune disorders are not the kind of thing that the pill for an ill is going to fix. You can't just do that. And a lot of doctors they either don't know or they don't want to spend the time. And so they just kind of shrug you off and try to say it's all in your head or send you off to the next person. And so, yeah, I think the customized healthcare that's definitely where it's at for sure. Absolutely. So is your background in like traditional like MD healthcare? Is that where you came from, or what kind of education did you pursue in the beginning?
Yeah, I all of my education revolved around, traditional medicine, Western medicine. But I had always had an interest in, again, alternative, complementary stuff. Even as a young girl, I always kind of like was really interested in that. But then when I got into the whole healthcare system and started working and being with patients, it this was a real thing that I had to overcome myself was really becoming kind of brainwashed into this Western type of healthcare and system of, and it's a system that they put you into. It's like this thing, this machine that they put you into because a lot of people depend on, I'm going to use insurance for an example. A lot of people depend on health insurance, and really health insurance is just so set up to maintain your illness. It's there to like keep you sick in so many cases. I think there's a for, catastrophic immediate things happening to you, yes, insurance is beneficial. But for the majority of the way that people utilize insurance, traditional insurance, health insurance, it's not set up to get you better. It's not set up to get you off of medications. How they have influenced how doctors see their patients, how much time they can spend with their patients, what a doctor's quota, I'm doing air quotes if somebody's listening to this, their quota of patients, they have to see of slots that they need to fill in order to get reimbursed, for these visits. It's all set up in this machine that is just not really geared for the patient and for them to get better. And especially with these autoimmune conditions, it impacts every other part of your life. All your quality of life is impacted by this condition that you have. And a 15-minute visit, right? Because all you get is like 15 minutes sometimes with these doctors. You can't at all begin to scratch the surface of how somebody is really feeling and how it's really impacting their life and showing up in all these other areas, how this illness is manifesting in all these other ways. But as soon as a provider hears a certain little buzzword, well, I got a pill for that, or oh, you got this going on, let's take you to get this test. Like that's just all that it turns into, and it's never focused on really getting you feeling better and having you see results. It's just all like, I'm just going because I'm sick, I'm just going because of this. And it's so and that's what I saw all the time, because we call them frequent flyers is what we call them in the hospital. People coming in all the time for the same things, exacerbations of the same thing. And I'm like, why aren't these people getting better? Like, I know there's things out there that can help these people, but why aren't they getting better? So that's what really another thing that drove me to wanting to work on my own practice and how I could really do things differently from what so many people were used to really make a difference in their quality of life overall.
Oh yeah, absolutely. No, you're absolutely right. And insurance is, yeah, it's not set up that way. And a lot of people, I think in the beginning, they just, especially, if they're starting out with their autoimmune journey, or maybe they don't even know what kind of autoimmune condition they have yet, they don't realize that, oh, insurance is going to cover you if you need to have a surgery or something, or you have a hospitalization or whatever. And, or maybe if you end up taking some drugs, you may get some coverage for those through insurance. But your insurance is not generally going to cover really getting to that root cause or the things that you really need to heal. And, I mean, that can be a harsh reality for some people, especially if they're not used to paying out of pocket for a lot of healthcare stuff. But, at the end of the day, like you said, it impacts all your quality of life. And so, I mean, there's ways of coming up with that money, I'm not going to get deep into that, but really, I mean, HSAs, for example, are one thing that people can consider exploring for, covering some things. But even then, I mean, your HSA is not going to cover everything that you necessarily have to invest in. So you just have to have kind of that mindset of, would you rather be sick all the time and sick forever, or would you rather invest some money in your health and actually get better? So
Yeah. And I think one of the easiest like places to begin, one of the like lowest barriers to entry, I guess we could also put it to, like when it comes to financial wise, one of the best investments of your money is going to be on getting some really detailed wellness testing. So wellness testing is different than, hey, let's look at your sed rate, right? Your sedimentation rate. Let's not look at your homocysteine levels, because those are the normal labs like CBC and BMP. Those are the normal labs that doctors are going to run on you.
Mhm.
What will tell you a better picture, a better story of what's going on with your health and what's going on with your condition is looking at different types of wellness testing. So, looking at micronutrient testing, getting some hormonal testing done, looking at food allergies, sensitivities, and tolerances, doing things to examine your gut microbiome. There's all kinds of different tests there. There's different tests we can do with just your saliva. There's different tests we can do just with your hair that will give us a deeper, better picture of what's really going on with you. Where are your levels at? Where are you high? Where are you low? What is your body trying to tell us? Because there's a story in that. And it just takes a really skilled practitioner to look at things a little bit differently to tell you what the new story is. Like, this is what the real story is. Like, this might have been what you're told. And even with that, I'll tell your listeners and your watchers this too, that those medications that they start putting you on and these different things that they start giving to you, those are absolutely going to impact your blood work. And monitoring your blood work throughout is so important. But again, so many practitioners just monitor the same things over and over again. And
Mhm.
other parts of your blood are being affected, your organs are being affected in other ways. And unless you're looking at the bigger picture and doing, a lot of really detailed testing, you're not going to be able to see the whole picture. So things will start to kind of go wrong, or you'll start to feel certain types of way, but they're still continuing to monitor the same data. And they're like, well, you're fine. Like all your labs are fine. And you're like, no, but I don't feel right. Like something's going on with me. There's something that they're missing. They're not looking at the whole picture because you know your body best. So there's other types of testing that we can look at. They're going to give us a better picture of what's actually going on with you, how you're responding to the medication, how you're responding to nutrition, how you're responding to activity levels, stress, all of that. Your hormones, like if you're over 40 and the hormones and what they're doing, all of those things are going to impact that. So those are just some really great, like low barrier to entry thing that you can do, because you can go online. There's different places that will do specific wellness testing for you. I have a lab shop that I have through my practice that you don't even have to be a client of mine's, that you can go and get any type of lab work that you feel like you need, that you're missing based on what might be going on with you. But these are like, anybody can do this because, again, traditional insurance, if you go to your doctor, they're going to just look at you crazy and be like, no, I can't order that for you. Like, they're not going to pay for that. And because they won't, because it's something that can possibly help you to feel better. And regular insurance is just not going to cover that, unfortunately.
Yeah, absolutely. Yeah. Well, if you want to share with us, maybe as part of the episode show notes, we can include the link to where people can get those tests along with some of the other stuff. Because I think, yeah, that would definitely be helpful to a lot of people. And a part of my own story is it took me about 5 years to even get my Hashimoto's diagnosis. And when I finally got it, I actually had to pay out of pocket at a naturopathic doctor's office because I tried 3 times through the testing at the regular doctors and my regular insurance, and they wouldn't do the tests. So I couldn't even get a Hashimoto's diagnosis out of my insurance. I had to pay out of pocket. So
Yeah, true story. I hear it all the time. I hear it all the time. But I'm glad you were persistent in that and that you got it figured out.
well, I just felt terrible all the time. And they kept telling me, hey, yeah, nothing's really wrong. And I actually had an acupuncturist that was reading thyroid problems off of my wrists and throat and tongue and things because that's kind of part of what Eastern medicine can do is they can figure out all kinds of stuff. And she'd been telling me for a couple of years that I'd been working with her that I had issues. And so I was like, okay, regular doctors are telling me I don't have issues. I feel like crap a lot. My acupuncturist is telling me I do have issues. There's something going on here.
Yeah, your body knows. Your body will tell you. Your body will tell you so much. It's just kind of learning how to listen to your body. And then, unfortunately, what I have to do a lot in my practice is I'll take like a consultative role, because in my practice, I don't prescribe medications. I work to get you off of the meds or reduce the meds. But when I take a consultative role when it comes to medications, what I always end up having to do is really teach you about your labs, get you the appropriate lab work, and then kind of arm you with all the data and all the information so that way you can make a case to that prescribing provider. That way they can adjust your doses of medication or maybe look at something different for you. And it's so sad that it's like come to that, but there are so many women that I've had to help to like be like a lawyer and make like a case, like this is how you present your case to your healthcare provider. But it becomes that. It becomes like an argument, a back and forth, like, this is what I'm asking you for. And they're like, no. And you're like, yeah, I want this. And like, it becomes a back and forth. So for me, a lot of what I do is consultative and like just giving you all the data, all the information, talking to you about it so that way you can present it in a way to support your case to get you what you need when it comes to comes to medications, or maybe even running additional tests or scans or whatever. That's happened a lot where I'm like, well, why haven't they done an ultrasound on you? And you're like, well, I tried. And I'm like, listen, this lab work warrants you getting an ultrasound done. Like, especially when it comes to like liver and kidneys, like really pushing for a lot of that other diagnostic testing that we need to look at to see what it's telling us. Because so often, and you're a great example of this, like so often we get the flags first, like we get the signs and the symptoms first, but then by the time the actual diagnosis comes, like there's all this damage that ends up being done. And it's like, if we would have just acted on it first when we heard the little bells, like we could have had maybe a different outcome versus having to wait so long and then trying to do something about it.
Oh, absolutely. Yeah. You're totally right on there for sure. And I've become through the years actually become really good at reading labs now, especially I don't read other people's labs. I only read my own, but it's like I get my lab stuff back and it's like, oh, I don't really even need the doctor to help me. I can figure out what this says because of, just a prior experience of, partly working with some functional practitioners that helped me learn how to read them, but then also just learning to know myself and looking at it and being like, okay, I know what this means, I know what this means. But I think part of it is that too often, that's the other thing, is that doctors don't do it. And it's not because they don't want to all the time. A lot of times they just don't have the time and resources to actually really explain to you what's really in your labs. They just can't. Like,
They can't. It comes to the end of the day and they've got like 100 lab reports in front of them. There's no way that they can sit down and go through all of those labs with every single person. And another thing too is, labs are so unique and individual to each person. And I know that there are ranges, right? We've all got our reference ranges and we've got our highs and our lows and our normal and our abnormal. But the way that they get those reference ranges is they just kind of average the US population or the population of people around you. And if you stop to think about it, is the average US population very healthy? Is the majority of people very healthy? No.
no.
So the lab results are kind of not in the healthier range of what they should be. They're not at an optimal level. So if you go see like a naturopath or a functional medicine specialist, they're going to be looking at your labs differently because we want those levels to be in an optimal range. So like high, low really doesn't mean anything to us when we're looking at your lab work, because there's optimal ranges that you need to be in. And to kind of put this into perspective for you, if you think about a woman who's pregnant, they're very specific, right, on making sure that the nutrition is a certain way, that even prenatal vitamins are a certain way, that your lab work falls within certain ranges and very tight, restrictive ranges. And that's because they want things at an optimal level for your health and for the baby's health. Why we don't carry this over to the rest of our life and for the rest of a woman's life, I don't understand. But again, it's how we're looking at the lab. So high, low, normal, abnormal, those really don't mean anything when it comes to how they're really calculating those ranges. Because again, they're based on the population, the average of most people, and most people are not very healthy. So when you're getting all of these normals or like low, high, right, or whatever it might,
Mm-hmm.
it's like it's like it doesn't really mean anything because it could be quote unquote normal and your doctor's going to just be like, okay, see you in 6 months or 12 months and let's do a redraw. But you still feel like crap. And so you continue to feel like crap till your next appointment. And it's, again, it's just not getting anybody better. We're not looking and interpreting those labs in the correct way. So that's another huge thing I like to put there out about lab work because not a lot of people realize that when it comes to their labs, but that's really what's going on when it comes to your lab work.
Oh yeah, absolutely. And I didn't realize that in the beginning either. And actually really only did learn it, like you said, when I actually was sitting down with an actual functional medicine doctor and she started explaining it to me that way. And I was like, oh, okay, you know?
Exactly. Yep.
So yeah, it's definitely pretty eye-opening for a lot of people. So let's transition a little bit to talking a little bit about some of these things like PCOS, hormone stuff, all the weight loss stuff, because I know a lot of people, in addition to, getting frustrated over their lab results, they also get frustrated with, why am I doing all the right things and I'm not losing any weight? What would you say to somebody that says that?
Well, it was funny because I was going to kind of transition into this when we were talking about the lab work because especially when it comes to PCOS, insulin resistance is a huge driver of PCOS, and not a lot of women know about insulin resistance, or if they've kind of heard about it, maybe they just think it's something that diabetics get, or type 2 diabetes, or whatever. But in general, what I've found is most people have like no clue what insulin resistance is. And actually, just the very fact that we women get older and that our hormones start to change and that we start to go through menopause and go through all those changes, just that event, that long event, until we know we're officially in menopause, that is actually a trigger for insulin resistance. So knowing what insulin resistance is really important, and it just is like what it sounds. You become resistant to your own insulin. Well, what does insulin do? Insulin reduces the blood sugar in our bodies. It helps us to break down all of that blood sugar, all of the carbs that we're eating that turns into carbs and glucose. It helps that to get into your cells, and it helps to keep those at a lower level because after you eat, those levels are going to spike of sugar, and then your pancreas puts out insulin, and then that helps to bring everything down and distribute all that glucose into your body. But what happens is um, with a lot of these hormonal changes and also with the diet that many people have ate for years and years and years and years, they become insulin resistant. So their body doesn't really respond to the insulin that they make like it should. And so their body has to continue to pump out more and more insulin. Well, insulin is not the greatest thing to have floating around in your body all the time because excess amounts of insulin lead to excess body fat. They lead to excess inflammation. It's just not something that's supposed to be in your blood all the time at high levels. And the other thing that I wanted to say about this was when we have the PCOS and we've got the weight gain, we have the insulin resistance. There was something else I was going to go say. Now I'm like losing my train of thought as I'm going on about this. Oh, lab work, fasting insulin level. You need to ask your doctor if you're watching this right now or listening to get a fasting insulin level because that's going to tell you where your insulin levels are kind of like normal on the day to day. And it's fasting. So without you eating anything, how much insulin do you have floating around in your body? It's really good to know what your baseline is, but also monitor it. So like you should have like a baseline and then like 3 months, 6 months to kind of monitor what your insulin levels are. Because many times a lot of physicians, a lot of providers are not looking at fasting insulin when fasting insulin levels should be low, But once they start to rise, and once we notice them start to rise, that's a ding, ding, ding bell indicator that you're starting to develop insulin resistance. And so then we can go in and start to make some changes when it comes to our nutrition, when it comes to our physical activity. Those are like the easiest things to switch when it comes to insulin resistance and developing that. But insulin resistance is a huge driver when it comes to PCOS and a lot of other autoimmune conditions. That insulin level is so important, and making sure that your blood sugars are kept as low as possible and as steady as possible. They're going to rise and go up and down because that's what happens when you eat. I mean, that happens. But you don't want like huge spikes all the time throughout the day. And also, you don't want like high levels all the time. That's what people who have diabetes, their blood sugars are just uncontrolled, very high blood sugars all the time, because all that, again, all that extra glucose just turns into fat, all that extra insulin starts to just create a lot of inflammation. It's just a lot of problems that are caused simply from insulin and insulin resistance. And it doesn't help with the hormones, and we want to collect fat right around our belly area. And that's what happens with when our hormones start to change, and estrogen and progesterone, it starts to change like that too. But we don't want to add on top of that insulin resistance as well. So mitigating that as much as possible. That's probably another topic for another show, but using nutrition therapy for that, really looking at your stress and your physical activity, those are all things that will just naturally help to bring that down. I'm a big teacher of intermittent fasting. I did intermittent fasting to kind of help with my immune and my skin issues that I had. Really, like, they thought I had lupus at some point because my skin was so bad. And I was able to get all of that cleared up and lose a lot of weight, not be pre-diabetic, no high blood pressure anymore, got off of my meds. I was able to see so much improvement in my overall wellness from doing intermittent fasting, but also being very conscious of my insulin levels and my blood sugar and how that was affecting the rest of my health.
Oh yeah, absolutely. I believe it. Yeah, I did a separate episode on intermittent fasting. So those of you that haven't listened to it, you want to go back and listen to it because I lost quite a bit of weight with it too. And
Amazing.
yeah, and I'm still doing it. And
Yeah.
if you bring up another important point about the insulin resistance, and that's another thing that when I started going to more like the functional medicine clinics for the doctor's office, they started doing that, testing that at the fasting level. But my regular doctor's office, like some of the ones I went to before I even had my Hashimoto's diagnosis, they didn't test that. And so
Mhm.
that is definitely another thing that, yeah, it's really, really important to be testing that because, yeah, it's can cause all kinds of issues if you've got insulin resistance and everything. Yeah.
Yeah. Yeah. And it affects your immune response, right? And what do we got an issue? We got autoimmune disorders.
Yeah, issues with your immune system. Yeah.
Our immune system is all messed up. So anything that we can do to strengthen our immunity naturally is going to be beneficial for you. And I have another really great suggestion for your listeners and for your watchers when it comes to supporting your immune system naturally. In my practice, I'm not into like lotions and potions and pills and shakes. I don't do any of that. I really focus on using food as medicine. Um, but one of the things that I love to use as part of the therapies that I provide for my clients is using IV hydration. And I don't know like how familiar maybe you are with IV hydration.
I'm not super familiar with it, but that's like a lot of those places that have like the Prime Wellness IV is an example of one, I think, and some of those places that give you an IV for like a hydration thing.
So it is. So it's like an IV, like you go to the hospital and you get hooked up to a bag, if you're sick in an emergency. Yes, we do that. But when it comes to supporting your wellness and kind of doing something that's extremely natural, but doing something that's extremely effective, IV hydration is like on a whole another level. And especially for autoimmune conditions, there's so many really great infusions that you can get because we're focusing on delivering vitamins, minerals, and electrolytes directly into your bloodstream. So there's no digestion needed. There's no pills you got to take. There's nothing you got to drink. There's nothing that your body has to sit there and break down, metabolize. it gets straight into your bloodstream and it acts instantly in your body. And so when it comes to your immune system, we can deliver some very powerful doses of vitamin C, of zinc. We can give you some vitamin D through an injection if we need to, if we're monitoring your vitamin D levels, which is really important for immune support and immune health. You really need that vitamin D. We can do a lot of things to reduce inflammation, like giving glutathione infusions. Those are really great. There's all types of little specialty, little things that we can infuse into your treatment that can just really support your immune system overall. B vitamins, helping you with your energy levels, because I know that's another huge thing that people, struggle with when it comes to autoimmune conditions. A lot of them have chronic fatigue and, just like a lot of that achiness and inflammation, that glutathione just helps amazingly with that. And these are things that you can get done. Again, insurance doesn't pay for them because these things work really, really well. And if you're able to work them into your wellness regimen, then absolutely it's something to look at and to consider. Because again, it's not having to take more pills, it's not having, to drink more things. This type of infusion gets directly into your system and it acts immediately, lasts for about 2 weeks in your system, 2 to 3 weeks, depending on what you're getting. But it will boost your levels like immediately. So anybody who is getting ready to travel, or like if you're getting ready to travel or coming back from a trip, I always recommend getting an infusion before or after. If you're somebody who works with a lot of crowds, you're a lawyer, you're working in a courthouse, you're working with kids, you're a teacher, you're working with crowds, definitely, especially with wintertime coming up, getting some type of immune boosting infusion is such a great idea. So there's lots of different benefits for it and lots of different people that could apply, that it would be great for, but that's another really great thing to help. And a lot of that extra hydration that you get just helps with everything too. It's a really fantastic way, again, to kind of boost yourself naturally with these things. It's no medications, it's no nothing. It's just vitamins, minerals, and electrolytes, but a more efficient way to get it into your system.
Yeah, that's a good point. I have tried it a time or two, just not, not on a regular basis. Probably maybe should do it a little more frequently. But yeah, and I know at least here in Utah where I live, there are some clinics that actually will take HSA cards for that kind of thing, even though they don't obviously take insurance. So, if you have that available to you.
Same thing like with my practice. I take HSA and FSA to kind of help with that. But yeah, a lot of those wellness clinics will take the HSA and FSA to use towards that. And what I was going to say, even for you, how you can kind of combine what you're doing is, that wellness testing that you get, if you get micronutrient testing, so looking at all the vitamins and minerals in your blood, you can take those results and figure out where you're kind of low or deficient or where there might be some gaps. And you can go to certain infusion clinics and be like, hey, this is what I'm really looking to get. Or you can kind of mix your own custom infusion based on what you need. Because that's what I do with my clients. I look at their lab work and I'm like, okay, this is the infusion that you're getting. This is what we're putting in it. So you can do the same thing with your lab results. Take what you know because you're good at reading your results now. So
Yeah.
to look and see where you feel like you could get a boost at. And then you can go to a place and just talk with them and see, hey, can we mix and match a little bit? Can we put this in here and this in here? I really need some of this. And see, a lot of the places will allow you to custom mix infusions for yourself. So that's a really great tip. If you're listening to this, that's another way you can kind of work around that and really advocate for yourself.
That's awesome. Cool. Well, you've given us some great information already so far. So if somebody is, really at the phase in their autoimmune, or maybe they just got diagnosed or they're really struggling, what would you say the very first step they should take should be? Should they do macronutrient testing first? Should they do some other labs? What's the very first thing you would recommend?
Yeah, the very first thing I would recommend is really look at your lab work, get some and go to somebody else. If you've been getting the same answer from the same person, go to somebody else, get some new lab work, get fresh eyes on where you're at and what your blood is telling you. Do micronutrient testing, do specialized autoimmune testing. There's thyroid panels out there, there's different hormonal panels. I get a lot of Lyme patients actually. I get a lot of women who have Lyme and then they
Why
end up
is
getting
it? Yeah.
yeah, mono after that. And, all of I get a lot of those. So, to find out what type, what symptoms you're having, and get some specialized testing around that, and look at the micronutrient levels, look at foods and food allergies and intolerances and sensitivities. Really gather up all that data for yourself. And a lot of the places that you go to for these labs, they'll be able to give you some information about how to interpret, your results. If you don't have access or can't access, somebody to help you interpret your results, there's usually some good resources out there that'll help you figure out, well, what's this telling me? And then you can kind of take it to the next step. But I would say first step is really get that really great detailed blood work, and then go from there, see what it tells you.
Awesome. That's great. Okay, well, any other last words of wisdom you want to share other than obviously tell us how people can connect with you? And we will have all those links in the show notes, both on YouTube and in Apple and Spotify as well.
Yes. So I'll share my favorite quote because it applies to everything, and anything. It's start from wherever you are with whatever you've got. That is my favorite quote.
Love
Start
that.
from where you are with whatever you've got. And it applies so well to our health. So in this day and age, there's so many resources out there for us. I think it can become too much sometimes and be very overwhelming. But again, start from wherever you are with whatever you've got. So if you've got some initial blood work, if you've got some initial testing done, start from there and have a new set of eyes look at it, and then, go from there. Just I would say also too, just don't accept what you've been told. Don't let your diagnosis become a label for yourself. Like, don't let it become your identity. You're still who you are. You're still a woman. You're still Anna Laura. I'm still Dr. Rosa. Like, we're still who we are. We're not this disease, we're not this label. There's so much life to be lived out there. Don't let that label or don't let that identity consume your life. I see that a lot as well.
That's awesome. I love that.
Hmm. And you
Okay,
can
so
find me
then,
all over.
yeah, so tell us then verbally, and then, like I said, we'll have the links below. Where's the best place for somebody to connect with you?
So I'm mostly on Facebook and LinkedIn. You'll find me Dr. Alexandria Rosa if you look on both places. That's where I am. I'm also on Facebook. I'm also on TikTok. I'm also on YouTube. You'll be able to find me. But if you really want to get in touch with me and like ask me questions or book a call or anything, the best way I always tell everybody is just to send me a message. Dr. Alexandria Rosa, find me on Facebook, find me on LinkedIn, and send me a direct message and it said, "Hey, I heard you on that podcast. You were talking about autoimmune conditions, and this is what I got going on." That's the easiest way to get a hold of me. But I love it when people send me messages and we get to talking. So that's the best way.
Cool. That's great. Well, thanks for coming on. Appreciate all the different things that you've had to share. And yeah, so get in touch with her if you want to do that. Like I said, we'll have some links below where you can check out like some of the labs and some of the other things that she's been talking about.
Yeah, absolutely.